So hopefully this is a short video on what is gender affirmation. In New Zealand and soon to be in other states in Australia, they're pushing the gender conversion therapy ban. And usually what they do is they piggyback wanting to have a conversion therapy ban based on conversion therapy that has occurred in the past, mainly to homosexuals. And they introduce something called gender affirmation. And generally speaking, most people do not understand what gender affirmation is. That's what I want to cover today. So, by the way, most of these notes are coming from the genderresourceguide.com. I'll put a link in the notes below because it's an excellent resource for parents that covers quite a number of issues, the how and why and wherefore of the transgender trend and how it impacts on children, and it's targeted for parents. So in the past, you'll find that the politicians and LGBTQI activist groups have sold conversion therapy bans, even though there has been no conversion therapy for the last 50 or so years. So in the old past, the goal was to convert homosexuals and gays to the appearance of being straight, or try to change their mind that they are in fact straight, that they are just making it all up or whatever. And so the focus was altering gays' kids' minds to make them straight. And there was some therapy that was done to do that, like electric shock to genitalia and hormone injections and drugs and camps that they were taken, almost like brainwashing sessions, and forced isolation and ice baths and food depravity and forced nudity and a whole bunch of sanctions that were brought onto the kid, a young person or people, in order to make them, hopefully to make them straight, which never worked. Okay, and that's what we learned from that. All those horrible things from homosexuals, it doesn't work. That the new conversion therapy, instead of focusing on the gay's mind, thinking that they've got it wrong in the head, they actually physically go straight to the body and strive to make them straight by changing the appearance of their form to conform to the opposite sex. So things to do that are puberty blockers, which we're going to talk about, castration, double mastectomies, cross-sex hormones, creating fake vagina and penises that don't work, and then making it compulsory by law. And this is the most scary thing: they make it compulsory by law that this is the action that you must take if you've identified a non-gender conforming young person, usually gay or autistic, and this is the course of action you take. And usually that involves also some removal of parental rights. It's happened over here in Australia and the rest of the world, and it removes family ties to safeguard the child, and a whole lot of heavy sanctions. Over here in Victoria, Australia, that's something like $1 million for a company, 250, 200k for an individual, if they do things that don't affirm gender identity. So the last was based on sex. This one, it's about, it's really funny because it's actually based on having a body to match what's in their head, which is actually false. So essentially the gender affirmation is kind of like a conveyor belt, because it starts in one point, social transition. It's the idea that you really are in the wrong body and that you need to change. And then the pathway, once it starts, is puberty blockers, cross-sex hormones, sex reassignment surgery, and legal document change. So let's start with the first one, social transition. So the gender affirmation approach includes social transition for children as young as 2 years old, which entails them getting haircuts or dressing to the appearance of the opposite sex. So for example, here's some of the products that go along with this, and if you'll see little packets, just imagine what it's like as a 2-year-old or a little bit older, that you're going to have those little penises stuck into your pants. How does it not make you think that there's something missing about you being a girl? What they do find is that this social transitioning actually does make young people more and more dissatisfied with the sex that they're at, because everything you're doing as an adult to that young child is affirming that they are in fact in the wrong body that's a message that they're getting from all the people around them. Then there's puberty blockers. Okay, so the use of puberty blockers in otherwise healthy adolescents is supposed to delay a normal stage of development. It's relatively new. They use off-label drugs that were not designed for this purpose, so they're entirely experimental. The 3 drugs that we use over here is goserelin, loperamide, and the triptorelin, and essentially they're used for people in late stages of cancer, endometriosis, used for castration. They're only meant to be used for 5 to 6 months, but they start as early around kids for about 9 to 11 years old, and they're using them for 5 to 6 years. Okay, so not approved, and here's the risks involved: brittle bones, joint problems, impaired memory. It tends to be that kids who got on puberty blockers, that's it, 100% usually go on to cross-sex hormones and the rest of the conveyor belt. And in 100% of cases that are measured, it causes permanent sterility. So cross-sex hormones, testosterone for girls, estrogen plus androgen inhibitor for boys. So all this is to induce the secondary sex characteristics, like growing a beard, voice changing, hair all over the place, or boys to develop breasts, that sort of thing. Okay, and the risk to that, sterility, if you use puberty blockers. For women, a low weight, balding, often cardiovascular disease, type 2 diabetes, bone density loss, increased risk of cancer, breast, cervical, ovarian, uterine. For men, breast growth, gallstones, weight gain, blood clots, sexual dysfunction, possible cardiovascular disease, type 2 diabetes, and breast cancer. Then you've got sex reassignment surgery. That is applauded. And here's this happy little fellow who thinks himself as Father Christmas because he cut off the breasts of, in this case, young 13 and 14-year-old girls. What a Father Christmas. So that involves top surgery, double mastectomy, breast implants, bottom surgery, which is removal of genitalia and reproductive organs. I think a few months ago someone mentioned on GoFundMe.com there's about 35,000 young girls wanting to have mastectomies, double mastectomies, under 16. The ages for this usually start around 14 to adulthood, and the risk, of course, loss of sensation. There's no sensation around all the breast and the genitalia area. It's irreversible. There's a lot of post-surgical complications. Genital SRS, and all this is common in both boys and girls. Then the last stage is legal document changes, so changing the sex that was recorded onto your birth certificate to the opposite sex. So this has a lot of risks. This can be done at any age, it's not just for children, but do note, here's something interesting. When they bring in gender affirmation, and that's mandatory affirmation for young people, it's not mandatory for adults, but it's mandatory for young people. It's a boon for the medical, industrial complex and pharmaceutical companies, because once you've got these kids on it, it's about 150 to 200K for the medical industry because you've got a permanent medical patient. They're going to have to stay on cross-sex hormones the rest of their lives and various drugs. But here's some risk. If you go to a hospital, there's been some few transgender people who have died because people have treated them as if they were biological male or female when they weren't, and because we are different biologically speaking, and if you treat a male like a female or a female like a male, you can actually kill them because our bodies are different, really different, like 6,000 differences between the sexes. So that's pretty different. So it's biology. So mistaken sex in medical care can be really dangerous, and it's really stupid to change that on the certificate. So, here's some things to think about if you're thinking about cutting off your child's testicles or supporting your girl to cut off her breasts, etc. Have a little thought before you do that. Up to 98% of children who struggle with their sex as a boy or girl come to accept their sex by adulthood. So I'll stick all the notes on that below. Identifying as transgender or non-binary may be linked to autism spectrum disorders. Children with autism spectrum disorders are 7 times more likely to want to be the opposite sex than the general population. They tend to be gender non-conforming. I have every program I run with my training has autistic kids, and I can tell you that's pretty much true. After sex reassignment, transgender identified people are nearly 20 times more likely to die from suicide than the general population. So it is in the Denton's Handbook as one of their strategies to overstate the vulnerability of the trans community, and they usually say the suicide if they don't transition, which is a load of poppycock. No, the suicide risk actually happens after. And why wouldn't it if you see what damage is done to the body and that it's reversible? And usually what the problem is that these young people, because they're young, it usually isn't until about 6 to 7 years later they really realise the full consequences of what was done to them. Just like Kira Bell. I'll read that up in Kira Bell, the Tavistock case. Studies show that 100% of children who use puberty blockers will go on to use cross-sex hormones and leaving them permanently sterile. Girls as young as 13 are undergoing double mastectomy. Boys as young as 17 are going full genital sex reassignment surgeries. The long-term effects of puberty blockers and cross-sex hormones have not been studied. This is experiments that we are doing on children. And that's why I say it's primarily homophobia, because it's piggybacked off the homosexual case in the past, and the pretense and the virtual signaling is that we wouldn't do that, and yet we are. We're doing it again. And then we're throwing in autistic kids as well. And it's known to most gender clinics that some transgender identified patients have been prescribed cross-sex hormones on their very first visit to the clinic. It's particularly worrying if you're a parent, because in schools they're teaching gender identity ideology, so they're pushing this idea that you're in the wrong body. And furthermore, if they identify, often with the help of a gender clinic, such as a Royal Children's Hospital in Melbourne, I put some of the Victoria's legal policies around this stuff, so you can read for yourself, then they're not obliged to tell the parents. And this has been serious, because we've actually had a kid taken away by the state. The parents to date haven't seen them for 3 years at the age of 15 to give their child a mastectomy. And because the parents were not agreeable to this, they were said to be abusive, and they haven't seen their child for 3 years. So this is one of the most scary things about the gender affirmation policy and the conversion therapy bills, is that the removal of the rights of parents and the ties to family is happening in our country, and it's heading your way, New Zealand.